Yeah, doctor. So now, now let's move on to the next question from our audience.
Sure.
Good morning, doctor.
Good morning, Johnny.
Uh, so recently, my aunt got hospitalized for severe urinary tract infection. Now she got recovered. I did a research and found women over 50 often experience urinary tract infection more frequently. I would like to know why it happens so, and what are the treatment options that we have, and is there any set of preventive steps that we can take?
So I'm assuming your aunt is menopausal, right?
Yes, yes.
So one of the things that happens with menopause is you're losing the protective effect of estrogen from your ovaries. So typically the pelvic, the vaginal mucosa gets atrophied, and the urethra, where the bladder drains into, is kind of right in top of that tissue. So the atrophy of those tissues makes it more prone for urinary tract infection. And also women in menopause might be also having other problems like pelvic organ prolapse, so they might have a bladder prolapse or a uterine prolapse that might further complicate urinary retention, things like that, which can increase the risk of urinary tract infection or infection that can ascend up to their kidneys. So in these women, the best way to kind of manage them is giving them a little bit of the estrogen back. So hormone replacement therapy could be an option for them, or even doing a topical estrogen therapy significantly reduces their risk of urinary tract infection. And then obviously at the same time you have to kind of evaluate for them for pelvic organ prolapse, talk to them about good bladder habits, making sure they're emptying their bladder on a routine and not holding back. And hydration might be an important, because older women tend to be not very good with their hydration status as well. So talking to them about all these aspects, and kind of managing with sometimes a little bit of hormone replacement therapy might benefit them from reducing the risk of frequent urinary tract infection. I hope that answers your question.
Yes, doctor. Thank you so much.
You're welcome.
Thank you, Johnny.